So then the next ones we have are, we're gonna do McMurray's first, and then we're gonna do Apley's, because you're already on your back. So I'm gonna tell you right now about the meniscal tests. They suck. They are not good at all about telling you if you have a meniscal injury, period. The best thing to do is have them tell you, you would say, how did you hurt it? So their mechanism of injury is going to tell you. And then you're gonna ask them, do you feel like it giving way or locking, clicking, popping, that kind of stuff? It doesn't have to be all the time, but especially like stairs, cutting, standing up and sitting down, changing direction kind of stuff. If they say yes to all of that stuff, or at least some of that stuff, it's probably a meniscus tear and you should send them for an MRI with arthrogram. Remember what the arthrogram is? That's when we put the dye in. The dye is gonna help because it kind of gets in the crevices so we can see it for sure. But these tests we're about to do, they could have a humongous tear in their knee and you would never know because they're bad. They're not very good. So what you do for these, for the McMurray's, is you're gonna put your hand on the top and you're gonna grab their heel. Remember how we did like the anterior drawer test for the ankle? And then what you're gonna do, and there's a couple different ways to do it, and this is how I was taught to do it. So you guys are gonna learn how I was taught to do it. Okay, ready? So the very first thing you do is you just flex their knee all the way up passively, and then you take their heel and you bring it all the way to the inside, and then, all the way to the outside. You just had crepitus. I don't know if you heard it, but it was a good one. Did that hurt? Okay. So you would also listen and feel for crepitus. That's a positive test. So again, you just kind of go through here and see if you can feel anything happen. And then what you do is you're gonna apply Varus and Valgus Stress as you do this. So you kind of come all the way in. So what am I pushing? I'm pushing. So this is going to be Valgus Stress, right? And as I come, notice I'm gonna take his foot and I'm gonna externally rotate it, and I'm gonna push all the way through, and then I'm gonna come back, and then I'm gonna do internal rotation and push all the way through and come back. And then I'll do Varus Stress, and I'm gonna do the same thing. I'm gonna do external rotation, and then I'm gonna do internal rotation. He doesn't like it very much because he's starting to use his muscles and help me out. And what I'm feeling for is any locking, crepitus, popping, catching, and if he reports pain, then that's gonna be a positive test. Again, I'm gonna tell you right now, this test is not very good. I've had lots of people have tears and this test not be positive at all, but I've also had this test aggravate people because if they have an MCL or an LCL or anything going on inside their knee, pushing their leg to full flexion and extension and then cranking on it like that can also cause them a lot of pain. So that's why it's not a super good test. But that one is the McMurray's test. Now I'm gonna have you flip over on your stomach. And now we're gonna do the Apley's compression and distraction test. So there's two parts to this test. The first part is the compression test. And remember how we just did the McMurray's, where I did internal and external rotation of the tibia. Relax for me. There you go. And so I'm gonna do that, and I did Varus and Valgus Stress as I did that, right? So what I'm doing though, hopefully you guys can see, is I'm pushing down through his leg. So I'm actually compressing the tibia into the femur as I do this. And what I would look for is, as I do it, if he says, oh, right there, or if I feel a click or a pop, or he says pain or something like that, I would stop. And then what I would do is I would flip my hands around. So he's like, right there, that hurts, don't press on it. And I would push down on his distal femur, and then you gotta relax there, Charlie. Yep. And then I'm going to distract. I'm gonna pull up on his tibia. I don't know if you guys can see his foot coming towards the ceiling, but that's distraction. And what should happen is his pain should go away if it hurts. So the compression test is going to be positive if it elicits pain. And then the distraction test is going to be positive if it makes it feel better. And if those two things are there together, then that's a decent sign that it's a meniscal injury. But again, this test also sucks. It's not very good. And you can do this test and not get any positive stuff. The other thing is, doing these things, same as how I said for McMurray's, you're stretching out a lot of soft tissue things. If they have fractures in there, it could do stuff. If they have osteochondral lesions, so if they have part of like the cartilage that comes off their tibia or their femur floating around in there, it can catch and cause problems. So you can have a lot of issues in your knee and have this particular thing hurt. If you do the compression test and it hurts, and you do the distraction test and it hurts, probably not a meniscus, it's probably something else. So that's what I mean. These particular tests, while they're great and you should have them in your tool bag, they're not the end all be all tests of everything.